Buckentot Optometrists are your children's vision specialists. With vision therapy, we can help your child develop their visual processing system to gain improved efficiency with reading and comprehension, and proficiency with gross and fine motor coordination, which will assist their education for life. We learn about our world through our senses, and 80% of what is learnt through formal schooling is visually based. When there is a visual sensory dysfunction, learning will be affected. Visual sensory dysfunctions include tracking, focusing, and eye alignment issues, as well as vision processing and integration. Eye tracking dysfunction can cause skipping when reading, rereading, losing your place when reading, using a finger as a marker, and whispering aloud when reading. Eye focusing dysfunction causes headaches, sore tired eyes and blurry vision, which worsens with fatigue. And eye alignment issues can lead to double vision, difficulty concentrating, slow reading and poor comprehension. If you or your child are concentrating to track your eyes across a passage of print or fighting to keep the letters in focus, then the effort used to concentrate on these tasks will result in tiredness and a desire to quit. A child will develop avoidance strategies, which may manifest as misbehaviour, withdrawal, a willingness to be distracted, and a general dislike of reading. In other words, as your child's stamina suffers, so does their willingness to read. Vision therapy is a series of exercises and activities designed to improve the function of the visual system. Improved efficiency results in improved concentration and stamina. For example, if you have to think about every activity whilst reading, concentrating on each individual word or sound, and using your finger to follow the print, then you're not thinking about what the passage of the text is about. Many people report becoming tired when reading, not remembering what they've just read, and having to read the passage of text all over again. Just as we must learn to crawl before we can walk, and learn to walk before we can run, the foundation of good vision comes from the development of skills which may first seem unrelated to the eyes. In vision therapy, we build on the ability level of your child through various activities with stepped increases in the degree of difficulty. Skill is grown to help create automacy, and in turn an increase in proficiency. As each level of proficiency is achieved, improvements in your child's ability to concentrate and to learn will be seen. Normal development of the systemic motor coordination occurs sequentially from gross motor to fine motor skills. If there is a delay in motor development, the ocular system, which is a fine motor skill, will be adversely affected. The first stage of vision therapy concentrates on the skills that integrate infantile retained reflexes, improving balance and awareness, and sequentially developing motor skills. These innate involuntary primitive reflexes lay the foundation for the development of integrated motor control. When primitive reflexes become upgraded, they provide a strong foundation for more sophisticated, specialized voluntary movement that are required for good eye control, binocularity, focusing, binocular integration, eye-hand coordination, and visual and motor integration. The vestibular system controls the system of movement and balance. Being aware of where you are in space will be challenged if the vestibular system is underdeveloped. The ability for a child to perform cross-lateral movements, or the ability to cross the midline, will have a significant effect on their ability to read, spell, write, and do serial decoding. As children mature, their ability to use rhythm, as seen in patterns of coordinated movement such as crawling, walking, running, skipping and jumping, becomes essential in relation to language development, reasoning, logic, pattern recognition, timing, and the understanding of mathematics. Building a solid foundation of motor skills is essential before beginning Phase 2 of vision therapy. Phase 2 is the oculomotor phase. This focuses on binocularity, convergence and divergence skills, allowing the eyes to function as a team and create a single stereoscopic vision. Often, before the eyes are ready to work together, there needs to be work done independently to acquire muscle tone for the individual eye, using an eye patch and specific motor activity to create equal strength on both eyes. This reduces the tendency to suppress one eye and let the other become more dominant. This in turn will allow the achievement of simultaneous perception, which is the building block towards step perception and stereopsis. Eye movement and vergence ability are enhanced through Marsden ball exercises and by using the Brock string. Once the oculomotor phase has achieved good coordination, visualization becomes essential. Visual memory games and using visualization activities help the development of vision processing skills. It is crucial for students to be able to use the visual system effectively. If a child is trying to memorize words that are not linked to concepts, then the information seems irrelevant. Words need to be translated into pictures so the child can create meaning. Visual memory and learning develops from the constant to the abstract. Developmentally, objects can be visualized first, then pictures, symbols and words. Once a visual memory is established, it can be manipulated through instruction. The ability to read proficiently requires proper vision processing skills, accurate saccadic and pursuit movements, balanced binocular vision, and a stable vestibular, motor and visualization system. With vision therapy, we can help your child develop their visual processing system to gain improved efficiency with reading and comprehension, and gain proficiency with gross and fine motor coordination, which will assist their education for life.